Don't be afraid to ask. I've seen dietitians and interns in the past both be hesitant. Hi everyone, my name is Kimaya Joshi and I'm a dietitian of Indian American descent. I work as an outpatient dietitian in the hospital setting, as well as conduct individual counseling sessions in my private practice at wellseasonednutrition.com. The topic I want to share with you all today is cultural competency in nutrition visits. The reason I want to talk about cultural competency nutrition visits today is because it's something that's been coming up a lot more often as a preceptor to interns. I'm getting a lot more interns that are asking about how they can be more culturally sensitive and especially how to feel more comfortable when dealing with clients of a background different than their own. So without further ado, here are my top 5 tips for conducting a visit with cultural competency. Tip number 1. Don't assume. Don't assume anything. In our growingly, globally connected world with fusion cuisines and access to ethnic food, avoid assuming that a person's name means that they eat a certain way. There's a reason that one of the very first things we complete in a nutrition visit is a diet recall. That diet recall really should serve as the first and most important base of your appointment and your guide to a client's typical eating patterns. Tip number 2, don't be afraid to ask. I've seen dietitians and interns in the past both be hesitant when dealing with clients with backgrounds different than their own and be hesitant to show a lack of knowledge. Let me be the first one to tell you it's okay if a client starts talking about something that you don't know. We've been through years of biochemistry, food science, medical nutrition therapy, counseling methods, and maybe even culinary training. But still, I don't think there's a single dietitian out there that knows every food and every cooking method. Even as an Indian American dietitian myself, I would not say I'm completely comfortable with every subculture and subcuisine of Indian American diets. When a client says something you're not familiar with, don't be afraid to ask. In my experience, clients are thankful when I'm asking for details. It shows that I'm engaged in the appointment and I'm tuning into their dietary decisions. Additionally, it helps me make more appropriate diet modifications once we get to the education and counseling part of the visit. Tip number 3, I encourage you to keep an open mind. This might sound like a very obvious tip, but I think it's definitely worth bringing up on its own. When completing a diet recall, a client may very well bring up a food combination, a serving style, or something else that's very new to you. For example, in South Asian cuisine, we typically eat with our hands versus utensils. And I won't go into the whole history behind it, but it's a very culturally normal and sanitary way to eat. As a dietitian, I urge you to keep an open mind when you're hearing things that are different than what you're used to. We're not there to judge or to correct a cultural food practice. Rather, as a clinician, we should be able to create an environment of understanding and successfully work with the client and their preferences free from any kind of prejudice. Tip number 4, watch the nonverbal cues, both yours and your clients. From you, frowning or starting of eyebrows, crossing your legs, shifting from eye contact to writing notes can directly convey what your thoughts are to your client, and it's kind of showing a response to their statements. Be mindful of what messages your body language might be sending, whether it's subconscious or consciously. From the client, remember that every culture has their own social norms and for social interactions. So based on their body language, if you're not really sure if they're comfortable or if they're understanding the information you're talking about or just not understanding you at all, I would ask what their thoughts are and develop that transparency in the communication. And that brings me right up to tip number 5. Be an active listener and take a minute to think about your response before responding. Really common tip I tell my interns is that a little bit of silence is okay. Silence can be kind of awkward, but on the flip side, I think it's an appropriate time to evaluate what culturally realistic recommendations would be. And this goes kind of back to thinking about SMART goals. For example, if you're seeing a client with poorly managed diabetes and they tell you they eat rice as a staple in their 3 meals a day, I would not recommend eliminating rice from any of their meals, even if it is the first and most obvious thought that comes comes to your mind, and identify some other more culturally appropriate recommendations to make. I think you'll find that your client is much more involved and interested in the appointment. Then as a bonus tip, I have tip number 6, which is just to explore. Outside of the professional field and your environment, if you're personally interested and invested in being a dietitian who can serve clients of all ethnicities and backgrounds, I encourage you to explore the community around you. So thank you for taking the time to watch this video. I hope you learned something about developing cultural competency in your nutrition visits. I know you're all going to be successful because you clicked on this video, which means you're already engaged in trying to develop a more inclusive background, which is wonderful. Feel free to reach out to me if you have any questions, any comments, any thoughts. I'm on Instagram at Well-Seasoned Nutrition, or I have a website, wellseasonednutrition.com, and you can scroll to the bottom to contact me directly. Thank you.